So it's really important to come for your checkups and cleanings as often as recommended. In your case, that would be every 6 months. We want to make sure we keep your teeth and gums healthy so that you can have them for life and you can have a nice, beautiful smile. So these are some examples of gum disease. And if we don't brush and floss, we build up plaque around our gum line, and your gums have a reaction to that plaque and to the bacteria in the plaque, causing your gums to be inflamed, swollen, and to bleed. And that's known as gingivitis. To prevent gingivitis, we need to make sure that we're brushing twice a day and flossing at least once a day. If gingivitis isn't treated, it can progress to more serious conditions called periodontitis, where you actually start to lose the bone around your teeth. And once we get to that stage, that's when people can have mobile, moving teeth and even looser teeth in some cases.